Hello everybody, welcome back to this channel. So we have already discussed analytical epidemiology case control study. So this video will be about cohort study. But before we move on, I'd like to suggest that you watch my video where I have explained the difference between these study designs, so you won't have a hard time cramming. The steps in these studies are confusing, so you might get confused and you cannot recollect it during exams and you get a long answer question on this. So that is why understand the difference between these studies. Do watch that video. Coming back to where we were, cohort study, always associate this word with follow-up, because what we do in the study is follow-up. It's very important. So coming to the, if you get a question on this, always start with definition as it puts a good impression. Then draw this framework or cohort design of this cohort study. It's very important. So in case control, we saw that the disease and exposure had already occurred. But in cohort study, we are proceeding from cause to effect. Okay, the disease has not yet occurred in this. We select a cohort, which is a population that is disease free. Then we divide them into exposed and non-exposed group. After they are exposed to that particular agent, say smoking, they develop the disease, say cancer. So again we divide this group. After being exposed, some develop the disease, and despite being exposed, some do not develop the disease. Now this non-exposed group, even not being exposed, they still develop the disease, and there are some who don't. Say we selected a population in 2010, then over the years they indulge in the habit of smoking. Say in 2012, 2014 or 2015, they indulged in the habit of smoking. Then again we did a follow-up and we saw that after a few years, say in 2021, some developed lung cancer while some didn't. So this is how we are going forward in time. That is why this is also called as prospective study, forward-looking study, and cause to effect study. So you should write this synonyms, and also called as follow-up study. So there are three types of cohort study: prospective, retrospective, and a combination. We already discussed the prospective study where the outcome was not present, that is we were going from effect to cause. This is why we call it forward study, because in that during the study the disease has not occurred. Then in retrospective cohort study, the reason why it is called as retro is because the outcome has already occurred and we are going back in time. The disease is present during the time of study, but the investigator goes back in time. We are tracing back through time, that is 10 to 30 years back. Say it is 2021. So we will check the records of 2010, the medical or past records or test records of the patients, to select the cohort. And from 2010, some people will indulge in the habit of smoking. So we will do the follow-up. Some might take up the habit of smoking in 2012, 2011, 2015. So that's how we'll select the exposed and non-exposed group. Then again we'll do the follow-up, and over the years we will see who developed the disease and who didn't. Like I said, I already discussed the difference between these studies is one of my videos, so make sure you watch that. So now we'll discuss the elements of cohort study, or the steps in this study. First is selection of study subjects, then obtaining data on exposure, selection of comparison group, like we had controls in case control study, but this is different. Then we do the follow-up, then analysis. So yeah, you can make a mnemonic for this, because you might not be able to recollect this during exam. It's little confusing. So selection of study group, we can select it from general population, or special groups. We can take doctors, nurses, lawyers, or exposure groups, that is people who were exposed to these agents, say radiologists. Second step is obtaining data on exposure. So in the case control studies we took history, but here we are going to take interviews. We are going to see the records of the patient, the surgeries they have undergone, the tests they have undergone, and the medical examinations. So the step 3 is selection of comparison group. Now there are two comparison, internal and external. So the internal comparison, we are going to divide within the group the members of group into comparison groups, and according to their level of exposure. Say the number of cigarettes smoked by individual is different for every individual. So that way. The external comparison is, say we do not have any information on degree of exposure, so we are going to use an external control, say smoker, non-smokers, or cohort of radiologist or ophthalmologist. Fifth step is analysis, which is very important. In the case control study, we were calculating the odds ratio. But here in the cohort study, we calculate the relative risk, attributable risk, and also we calculate the incidence rate. So you make this table in exam, and this way we calculate the incidence rate. And then you also remember this formula for relative risk. When relative risk comes to around 1, that means there is no association, and if it is more than 1, that means there is a positive association. If less than 1, that is negative. So you write down this, and you can write it this way, that when it relative risk of 2, it indicates that the incidence of disease in exposed is twice higher than in non-exposed. So actually it tells us about the strength of association between risk factor and disease. You must write this point. Then we calculate the attributable risk, which is also called as absolute risk. You write this formula, and it is the difference of incident rates of disease among the exposed and non-exposed. Also write this population attributable risk and its formula. And you should make note of this point, that cohort study is very tedious, expensive, and time consuming, which is why we do not do it for the study of rare diseases, but we do it for the study of rare cause. This is very important, and this is the most reliable study. So that was all about cohort study. Hope you love the video. Thank you.